to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to the Healthy Living edition of KUAM News Extra. The Lupus Foundation of America estimates that at least 1.5 million Americans have lupus. It is a chronic autoimmune disease that can damage any part of the body, whether it be the skin, joints, and organs in the body. It's actually believed that as many as 5 million people throughout the world have some form of lupus. Our body's immune system produces antibodies that help fight off viruses, bacteria, and germs, but in someone who has lupus, the immune system can't tell the difference between foreign invaders and the body's healthy tissues. Now, here to tell us more about this disease that has impacted many people on Guam and many more around the world is Express Care's Dr. Jitka Lom. Thanks, Doc, for coming in like the new do.
Thank you.
Let's talk. Lupus isn't a cancer and it's not contagious. So how does somebody get lupus?
Yeah, well, that's the million-dollar question, because nobody truly knows. We know that there are genetic factors. From twin studies, identical twins will be more likely to have lupus, both of them, but non-identical twins won't. So you know there's some genetic link, but it's not 100% genetics, because not all of the twins will both have lupus. So that's how you know. And then there are some environmental factors such as medications. Certain medications can trigger it, and other stressors. No one really truly knows.
Okay, so what are some of the symptoms of lupus? And I was reading that this is known as the great imitator, right? Because people can have different sorts of symptoms, and because it affects people differently, some people might not know that they have it.
That is very true. So there are criteria. There's 11 different. There's a list of 11 different things. One of them is a blood test, but the other things, as you mentioned, are skin involvement, such as rashes on the face and also on the body, joint involvement, meaning arthritis and swelling, kidney involvement, destruction of the kidneys, including protein in the urine. There can be heart involvement, involvement of the brain with seizures. So there's a whole list, and you need 4 out of the 11 in order to qualify for lupus. That's systemic lupus. You can be lucky and have only just skin problems, and that's called discoid lupus, and that's a more fortunate form of the disease.
So how does somebody find out, when they go to the doctor and maybe they notice that their skin, they've been having skin rashes or something?
Yes.
So how would somebody know? How do you get tested for lupus?
Well, you do the blood test, but not everybody with lupus will have a positive blood test. But you do the blood test and you ask the questions about these different organ system involvement. And sometimes it's over time that it develops. One of the things that really makes lupus worse in almost everybody is the sun. People are super photosensitive, and that means that the sun will aggravate their disease, in particular the skin problems, but sometimes the other health problems as well. So if somebody's noticing that, gosh, every time I get in the sun, I break out in a rash, I get these weird patches on my body, I feel very ill, then that's a sign that maybe they should be tested. Or if they get the swelling of their joints, or if sometimes on a routine physical we'll find some things like unusual urine specimen with more protein in it. Those kind of things will alert you. But sometimes it's very vague, and the person's just tired and run down and kind of not feeling that well. Over time, it becomes apparent.
Okay, and so let's talk about the one thing I read up as flares.
Yes.
They call it flares because there is no cure for lupus.
Right.
So sometimes people can actually get their symptoms maybe under control, and then there will be flare-ups.
Yeah. That's exactly right. So it is a lifelong disease. In some people it's fatal, but in most it's not. It's just something that they live with their whole life. And we keep it under control with medication that suppresses the immune system. Because as you said so nicely at the very beginning, this is a disease where your own immune system is attacking yourself. These different parts of your body are being attacked by your own immune system. So we use immune suppressive drugs like prednisone or steroids or other type of medication like that that keep your immune system down. Now, that also means you're weaker, right? You will be more likely to get flus and other symptoms, including cancer, especially the bone marrow type cancers, the cancers that arise in the blood, like leukemia, lymphoma, those type of things.
Okay, and so I was also reading that lupus strikes mostly women of childbearing ages between 15 and 44. Do you know why that is?
In women, lupus is more likely to come if you have a high level of estrogen. So women, of course, have more estrogen than men, so we're more likely to get that disease. Also, sometimes birth control pills can trigger it. So again, if you have a history of lupus in your family, maybe you shouldn't be taking birth control pills.
Okay, you were talking about how lupus can affect the skin, the joints, and the organs. Let's talk a little bit about the organs. You talked to, you mentioned about the kidney.
Kidneys, yeah. On Guam, we do have quite a burden of lupus nephritis. That means disease of the kidneys caused by lupus. And it's basically a destructive disease where the people will develop maybe high blood pressure along with it, but basically end up on dialysis. And so if someone's diagnosed with lupus, the skin things and so on, that's very unpleasant, irritating, but not life-threatening, whereas, of course, the kidney disease can be life-threatening. So that's one that we watch very, very carefully, keep monitoring the blood and the urine, and try to protect and help the kidneys as much as possible. And this all sounds so scary and horrible. The good news is that there is so much good therapy for lupus now. We have many new wonderful drugs that help the immune system stay under better control, and people with lupus can live a long, great life if they take care of their disease. And one of the most important things is for them to take their medication and stay out of the sun, and that's so hard on Guam.
Of course.
Really hard.
And that's what the one question before we throw to break is, you mentioned prednisone and steroids and some of these medications.
Yeah.
Will somebody on lupus have to be on medication for the rest of their life?
They have to be on it very long term until they get into what's called remission. We kind of do blood tests almost every month, checking to see how you're doing, how you're doing, how you're doing. And once they're kind of stable, then you start sort of wean off the medicine very carefully, very, very slowly, and then you see, and people can go into remission. And when they do, then that's great, and they just take excellent care of themselves and hopefully not have a flare, but flares can occur.
Okay, sounds good. Well, we've got to take a quick break, but when Healthy Living returns, we'll take some of our viewer questions on the topic of lupus. Stay with us.